But let's bring the conversation, or at least shift gears a bit, and turn your attention to this. Health Minister Dr Zweli Mkhize has been appointed chair of the Elimination 8 Ministers of Health Council, and that's a coalition of 8 countries working to defeat malaria in Southern Africa by 2030. Now, every year, about 500,000 people die from the disease, with Africa accounting for 94% of all fatalities. But since the establishment of the SADC Elimination Council, the region has seen a significant decline in malaria cases and deaths. One of the speakers at this year's Malaria Day webinar is Dr Jaishree Raman, and she's Principal Medical Scientist at the National Institute for Disease Control. She joins us now live via our video link. Doc, thanks very much for your time for this important conversation. Welcome to the AM Report. So about 500,000 deaths still every year for a disease that is both preventable and curable. Why does, on the face of it, does it appear we're still struggling so significantly with a disease like malaria?
Well, it's a really very sad thing. It's because it's mainly in the developing world. It's not seen as a major priority. So though there's been a lot of funding that has come in and it has helped reduce the burden, many countries still don't have enough money to put in basic interventions and ensure that everyone has access to universal treatment and testing. And so that's really one of the major reasons. It's really limited to, as you stated, to Africa, where there's a very fragile health system with a lot of infectious diseases competing for attention. And sadly, malaria sometimes doesn't get the attention it requires.
Yeah, and of course we've learned over the past few months that several diseases have been even put further into the back burner because of the COVID-19 pandemic. I wonder how efforts by doctors, health professionals, people who work in your field have been hampered by COVID-19.
So it's been very interesting in malaria, particularly in the southern hemisphere with COVID-19, because it's been the low season. So it hasn't really affected us in malaria that badly. But what we are concerned about now is moving into the malaria season is that the symptoms of COVID and malaria, and like a number of infectious diseases, are very common. They're very non-specific, and the main one is fever. So we are really concerned that people are not going to consider malaria now, because COVID is on everybody's mind, if they start, having the normal malaria symptoms like fever or a headache. So, while it hasn't really affected us that badly so far in terms of malaria, we are concerned now moving into the malaria season.
Yeah. So I've mentioned Health Minister here in South Africa, Dr Zweli Mkhize, now being appointed as the chair of the Elimination 8 Ministers of Health Council. I wonder how much political influence this council has. Help us gauge a better understanding of the mandate, and again, how much work it can actually do in the Southern African region.
In fact, the Elimination 8 has been one of the major things that has driven the elimination agenda in these 8 countries. It's been very effective because it's got a lot of political buy-in, and they have put in some really great interventions that have helped countries, both the eliminating countries, get closer to elimination, and the countries that are on much higher burden get closer to moving from control to elimination. So having this body that is part of the SADC organization with political will has definitely raised malaria on the health agenda and helped it keep there. So I think it's a really great boost for South Africa, and will help us with our elimination agenda, having our health minister being the president or the head of this organization.
Right, and outside of South Africa having what many people are considering a healthier economy in Southern Africa, what is the significance of a health minister like Zweli Mkhize now taking the chair of this council? I imagine, of course, it's got to do with more than South Africa having bragging rights to be leading this important council.
Oh, absolutely. It's really, I think within the SADC region, we definitely work very closely together. And having a country that has a little bit more further down the line in terms of elimination, having a minister showing what can be possible and encouraging other people to follow this lead, I think will help the region greatly progress towards elimination, and will foster greater movement of technology and capacity across the region to ensure that we can all get to elimination, which, as you say, is very possible. And malaria really shouldn't be a problem in 2020, but it still is.
Yeah, and I'm interested to find out why there isn't buy-in from the rest of the world. I mean, we've kind of seen ways through which the globe can galvanize around certain issues, of course, COVID-19 being the most obvious example, but there are transnational institutions like the World Health Organization, I mean, are they helpful in our efforts to try and clamp down on, again, this completely curable and preventable disease causing carnage in some countries in Africa?
Absolutely. I mean, the World Health Organization has played a pivotal role, but it is just a recommendation from the WHO. They can't do much else. I mean, the control that we've had and efforts to eliminate malaria have really come from NGOs and primarily the Global Fund and Bill and Melinda Gates Foundation. And without that funding, it wouldn't be possible. South Africa is one of the few countries in Africa whose malaria control program is completely domestically funded. All the other programs require funding from other international organizations to drive the elimination or control agenda. So without domestic funding coming to the party as well, it's going to be impossible for health systems to deal with it if you are relying on donor funding to eliminate a disease or control a disease.
Yeah.
So while there is a lot of buy-in from international organizations, it's very difficult if you don't have a domestic party ensuring you have continual funding to fund your malaria control efforts.
It does seem like the making of a perfect storm, isn't it? I mean, we already have economies in Southern Africa in the doldrums, exacerbated again by the COVID-19 pandemic. But I'm interested to have the conversation around the strength of democracies in certain African states and their ability to combat malaria. Again, South Africa stands, dare I say, as an example of what having a semblance of a functional system could mean specifically for vulnerable groups, including children and pregnant women, who I understand are amongst those who are most adversely affected by malaria.
No, absolutely. Being able, and you've highlighted the most vulnerable groups, and they are. So we have to have a universal access, and it has to be able to reach all the vulnerable populations, and even the highly mobile and migrant populations and refugees. They have to have access to treatment and testing of malaria if we are going to control it. So definitely we need to be able to, we kind of need a overall very strong health system that can encompass and deal with all infectious diseases effectively.
So the goal is to get malaria off our land, so to speak, by 2035, 15 years odd still to go. Help us understand what the strategy is given the challenges you've already outlined.
So basically, really, every country is trying to do work together, but also individually, is trying to reduce the malaria burden in their countries, but working again together to remove malaria moving across borders. So it's very much a concerted effort to make sure we have very effective control measures in. So making sure that you have effective drugs in, you have effective ways of killing mosquitoes. People ensure that they don't have areas where mosquitoes can breed. So it's all working together in it's very, very simple, basic things, but working together effectively and doing it in a sustained manner to ensure that we can get rid of this disease is really the only way that it will work.
Yeah, absolutely. And before we let you go, Doc, help us understand the impact that malaria has on, developing nations in contrast to other diseases. I mean, often we speak about Ebola, which had remnants in the DRC, if memory serves me well. When we compare our response to diseases like malaria, how does it fare to our response to other diseases that have hit particularly Southern Africa?
So, malaria really does have a great impact. It really reduces the number of hours children go to school. It reduces your work hours that you go to work. So it has a great impact on GDP. They found definitely if you remove malaria, your GDP can improve by 20%. And even health outcomes of children of going to school, their retention and their ability to concentrate is negatively impacted by malaria. So being able to address and eradicate a disease like malaria will improve the health and well-being of the youth as well as your economy. So, it's a really fundamental and basic concept that if you get rid of a disease, you will improve the health and well-being and your economic output of a country.
Absolutely. Well, Dr. Jaishree Raman, let me thank you very much for your time, helping us highlight this important issue despite the volatility of the news cycle. It's great to hone in on these important matters that, as you have outlined already, really do shape one's future prospects. Thanks very much indeed for coming through. Dr. Raman is Principal Medical Scientist and Head of Anti-Malaria Drug Resistance Monitoring at the National Institute for Disease Control. Once again, appreciate your making time.